ഹായ് എവരി വൺ, വെൽക്കം ടു അവർ ചാനൽ. എല്ലാവർക്കും നമ്മുടെ ചാനലിലേക്ക് സ്വാഗതം. എല്ലാ മത്സര പരീക്ഷകളുടെയും പ്രീവിയസ് ക്വസ്റ്റ്യൻ പേപ്പർ ആൻഡ് ആൻസേഴ്സ് ആണ് ഈ ചാനലിലൂടെ നമ്മൾ അപ്ലോഡ് ചെയ്യുന്നത്. ജോലിക്ക് വേണ്ടി പ്രിപ്പയർ ചെയ്യുന്ന എല്ലാ ഉദ്യോഗാർത്ഥികൾക്കും ഇത് ഉപകാരപ്പെടും എന്ന് വിശ്വസിക്കുന്നു. ഓരോരുത്തരുടെയും യോഗ്യതയ്ക്കനുസരിച്ചുള്ള ക്വസ്റ്റ്യൻ പേപ്പറുകൾ വേർതിരിച്ച് കണ്ടെത്താൻ ചാനലിലെ പ്ലേലിസ്റ്റ് പരിശോധിക്കുക. ഈ ചാനൽ നിങ്ങൾക്ക് ഇഷ്ടപ്പെട്ടുവെങ്കിൽ മറക്കാതെ സബ്സ്ക്രൈബ് ചെയ്യുക. തുടർന്നിടുന്ന വീഡിയോകളുടെ നോട്ടിഫിക്കേഷൻ ലഭ്യമാകാൻ ബെൽ ഐക്കൺ ക്ലിക്ക് ചെയ്യുക. ഓക്കെ, ഇനി നമുക്ക് വീഡിയോയിലേക്ക് പോകാം.
ഇന്നത്തെ നമ്മുടെ വീഡിയോ സ്റ്റാഫ് നഴ്സ് ഗ്രേഡ് 2 എക്സാമിന്റെ പ്രീവിയസ് ക്വസ്റ്റ്യൻ പേപ്പറാണ്. എക്സാം ഡേറ്റ് 9/7/2021 ആണ്. നേരെ നമുക്ക് വീഡിയോയിലേക്ക് പോകാം. ഫസ്റ്റ് ക്വസ്റ്റ്യൻ, ചൂസ് ദ കറക്റ്റ് സ്റ്റേറ്റ്മെന്റ്. ഓപ്ഷൻസ് ആർ angiotensin 2 prevents sodium reabsorption. Option B, angiotensin 1 is physiologically inactive. Angiotensin 2 is a precursor of angiotensin 1. Fourth option, angiotensinogen is produced by the kidneys. Correct answer, option B, angiotensin 1 is physiologically inactive. Next question, the axillary tail of mammary gland is known as. Answer, option D, tail of Spence. Next question, the following are the major blood vessels which supply liver except. Answer, option A, porta hepatis artery. Next, the anterior end of the corpus callosum is known as. Answer, option B, the genu. Question, which is the largest brachial plexus? Answer, option C, radial nerve. Sixth question, free living microbes that live on dead or decaying organic matter are known as. Correct answer, option B, saprophytes. Next, bacteria with a tuft of flagella at one end are called. Option A, Lophotrichus. Next, biohazard symbols on a specimen represent. Answer, option D, suspected of having highly contagious disease. The characteristics present on a primary social group is. Answer, option C, physical proximity. Next question is, the process by which social order is established and maintained is called. Answer, option A, social control. Next, which statement is correct about cognitive dissonance? These are the option. Correct answer, option A, a theory of attitude change developed by Festinger. Next, according to Freudian psychology. Answer, option C, all the energy used for performing the work of personality is obtained from conscious instinct. Next question, which psychological theory explains about schizoparanoid position as part of psychological development? Answer, option D, object relation theory. Next, which is not a correct statement about stress? These are the options. Correct answer, option D, according to Lazarus and Folkman, in primary appraisal of an event, benign positive outcome is one that holds no significance for the individual. Next, preventing unacceptable or undesirable thoughts or behaviors from being expressed by exaggerating opposite thoughts or type of behavior is termed as. Answer, option B, reaction formation. Next, ego, ideal and the conscience are two important components of. Answer, option C, super ego. Next question, Durkheim studied the individual's interaction with the society in which he or she lived and described 3 social categories of suicide. Which of the following term is not included in his theory? Correct answer, option B, societic suicide. Next, I make this choice because it is morally right and my duty to do so. This statement is an example of. Correct answer, option B, Kantianism. Next, which is not an ego defense mechanism? Correct answer option B, obsession. Next, consistent individual difference in behavior that are biologically based and are relatively independent of learning system of value and attitude is answer option C, temperament. Next, what is the origin of the serotonin pathways in the brainstem? Correct answer option C, RAF nuclei. Next question, euphoria, lethargy, somnolence, apathy, dysphoria, impaired judgment, pupillary constriction, drowsiness, slurred speech, constipation, nausea, decreased respiratory rate and blood pressure are the intoxication features of which substance? Correct answer option A, opioids. Next question, what is the most suitable nursing diagnosis for a person who has abuse of alcohol and cannabis, destructive behavior toward others and self, inability to meet basic needs, inability to meet role expectations, risk-taking behaviors? Correct answer option C, ineffective copying. Next, which of the following statements are correct about schizophrenia? These are the options. Correct answer option A, 1 and 2. Next question, which are the correct statement related to cognitive psychotherapy? These are the options. Correct answer option B, 1 and 4. Next question, paralysis of the ocular muscles, diplopia, ataxia, somnolence and stupor are characteristic features of. Correct answer option D, Wernicke's encephalopathy. Next question, criteria for substance dependence include all except. Correct answer option D, development of motivation to quit the behavior. Next, a delusion of misidentification characterized by a person's delusional belief that an acquaintance, actually a spouse or other close family member, has been replaced by an identical looking imposter or several doubles. Correct answer option B, Capgras syndrome. Next question, which of the following concept is related to Pavlov's conceptual model? Answer option Z, a therapeutic or helping relationship is established through use of these interpersonal techniques and is based on a knowledge of the theories of personality development and human behavior. Next question, which of the following drug is a monoamine oxidase inhibitor? Correct answer option A, tranylcypromine. Next question, a low-pitched rattling sound resembling snoring hearing on auscultation over is termed as. Correct answer option B, rhonchi. Next, hypoventilation can lead to. Answer option C, respiratory acidosis. Next, normal pH range of blood is. Correct answer option A, 7.35 to 7.45. Next, the most preferred site for intramuscular injection in infants. Correct answer option B, vastus lateralis. The question is, exercises that strengthen muscles and do not require joint movement are called. Correct answer option B, isometric. Next, protecting the right of client by doing no harm or preventing harm is called. Correct answer option C, non-maleficence. Next, hyperresonance during percussion of the lung field indicate. Correct answer option C, pneumothorax. The compression ventilation ratio while performing single adult CPR is. Answer 30:2. Next, first aid measure for sprain. Answer option B, rest, ice, compression and elevation. The question is, which color-coded container should be used to discard cytotoxic waste? Answer, yellow. Diet that promote healing of gastric mucosa is called. Answer option B, bland diet. Next, a patient with traction for fractured hip has an order for low molecular weight heparin subcutaneously. This is indicated for, correct answer option C, preventing DVT. The most potential danger of agranulocytosis that occur due to side effects of medications is, correct answer option B, susceptibility to infection. Next question, Romberg's test is used to assess answer option A, ataxia. Temporary period of normality in a patient's neurological status following head injury is called, correct answer option Z, lucid interval. Next, cardiac glycosides are drugs used to, correct answer option Z, maintain normal heart rate and rhythm. Next, while carrying a patient suspected for DVT, the nurse should not, correct answer option Z, massage or exercise affected limits. Next, the collapse of the alveoli due to obstruction or hypoventilation is called, correct answer option C, atelectasis. Next, which among the following breathing exercise is most beneficial for a patient with COPD? Correct answer option Z, pursed lip breathing. Next, a contagious disease caused by Treponema pallidum by intimate contact or in urine transmission is, correct answer option D, syphilis. Next, the mode of transmission of Japanese encephalitis is, correct answer option B, bite of infected mosquitoes. Next, the open vial policy is applied to all vaccines except, correct answer option A, measles vaccine. Next question, the classic triad to congenital rubella syndrome includes except, correct answer option D, polydactyly. Next, the number of new cases occurring in a defined population during a specified period of time is, correct answer, incidence. The natural family planning method include except, answer option A, menstrual regulation method. Next, visual inspection with 5% acetic acid is a screening test for, correct answer, cervical cancer. The continuous scrutiny of the factors that determine the occurrence and distribution of disease is, correct answer option B, surveillance. Question, hemorrhagic disease is newborns is prevented by the administration of, correct answer option A, vitamin K. Next, the body mass index is measured by, answer option D, weight in kilogram divided by height in meter square. Next, egg contains all the nutrients except, answer option D, vitamin C. The clinical types of protein energy malnutrition according to Wellcome Trust classification is, correct answer option A, underweight, kwashiorkor, marasmic, kwashiorkor. Question, progressive non-bilious vomiting after feeding in the neonatal period is a classical finding in, correct answer option D, hypertrophic pyloric stenosis. Question, the major complication that may develop during the acute phase of glomerulonephritis, correct answer option B, hypertensive encephalopathy. Next question, a congenital heart defect in which the blood pressure in the legs is much lower than the blood pressure in the right arm, correct answer option B, coarctation of aorta. Next, if a child with sickle cell disease present in the reticulocytopenia, the first consideration should be given to infection with, correct answer option A, human parvovirus B19. Next, according to Jean Piaget, the cognitive development stage of a preschooler is, correct answer, pre-operational. Option A is the right answer. Question, the blood studies of a child with maple syrup urine disease shows, correct answer option Z, elevated level of valine. Next, scoliosis is a condition characterized by, answer option B, lateral curvature of spine. Next, a disorder in which there is a problem with reading despite normal intelligence is. Correct answer option D, dyslexia. Next, which of the following statements are correct about baby-friendly hospital initiative? These are the options. Correct answer option B, only 1 and 3 are correct. Next, presence of gas in the fatal large vessels is known as. Correct answer option A, Robert's sign. Which of the following fatal factor is a cause for oligohydramnios? Correct answer option Z, renal agenesis. Next, which of the anti-tuberculosis drug is indicated in pregnancy? Correct answer option B, tobramycin. Next, in pelvic organ prolapse, laxity of lower third of anterior vaginal wall result in. Correct answer option A, erythrozyl. Question, in assisted reproductive technology, which drug is used for ovulation induction? Answer option Z, clomiphene citrate. Next, oval shaped brim is characteristics of which pelvis? Correct answer option B, anthropoid pelvis. Next, which of the following statement is false regarding assisted breech delivery? Correct answer option A, keep baby's back always posterior. During uterine contraction, the upper pole contracts and retracts while lower pole contracts and dilates. This coordination between the upper and lower pole of the uterus is termed as. Correct answer, polarity. Next, molding of fetal skull plus and vertex at +2 station in a partogram indicates. Correct answer option B, overlapping of skull bones but reducible and vertex 2 cm below the ischial spines. Next question, fundus of the uterus is palpated at the level of umbilicus which week of pregnancy? Correct answer option B, 24th. Next, the most important goal for conducting nursing research? Answer option B, promote evidence-based nursing practice. Next, which form of reasoning proceeds from general to specific? Answer option A, deductive reasoning. Next, by education, I mean all-round drawing out of the best in children and man, body, mind and spirit. These are the words of. Correct answer, Mahatma Gandhi. Which among the following is the best example for self-paced learning method? Answer option Z, programmed instruction. Which among the following is not a measure of dispersion? Correct answer option A, mode. Next, sampling error can be minimized by. Answer option Z, selecting large sample based on random sampling. Next, dash technique uses several rounds of questions to seek consensus on a particular topic from a group of experts. Correct answer option D, Delphi technique. Next question, dash is the plan of how the research study will be conducted. Answer option B, research design. Next, dash occurs when study participants respond in a certain manner because they are aware that they are being observed. Correct answer option Z, Hawthorne effect. Next, the type of reliability which addresses the extent to which all the items in an instrument measures the same variable. Answer option A, internal consistency. Next, example of a single-use plan. Answer option B, program. Next, civil wrong committed by one person against another. Answer option D, tort. Select an on-the-job training method. Answer option A, job rotation. Next, most preferred leadership style in recent times. Answer option C, transformational. Fidelity means. Answer, striving to keep promises. Option B. The number of subordinates a supervisor can effectively supervise is referred to as. Answer option D, span of control. Next, statement of organization's long-term aspiration. Answer, vision. Consumable items are generally termed as. Option B, supplies. An inventory management technique based on criticality of item. Answer, VED analysis. Option C. Next, primary health centers were developed in India under the recommendation of. Answer, option B, Boer Committee.
ഓക്കെ ഫ്രണ്ട്സ്, ദിസ് ഈസ് ഓൾ ഫോർ ടുഡേ. ഈ വീഡിയോ നിങ്ങൾക്ക് ഇഷ്ടപ്പെട്ടുവെങ്കിൽ ചാനൽ സബ്സ്ക്രൈബ് ചെയ്യുക, സപ്പോർട്ട് ചെയ്യുക. കൂടാതെ ലൈക്ക് ചെയ്യാനും ഷെയർ ചെയ്യാനും നിങ്ങളുടെ അഭിപ്രായങ്ങളും നിർദ്ദേശങ്ങളും കമൻറ്റ് ചെയ്യാനും മറക്കരുത്. ഓക്കെ, താങ്ക് യു ഫോർ വാച്ചിങ്.